All right, today we're diving into a medical case that absolutely baffled doctors. I mean, this is a story where the body's symptoms just seem to follow their own strange logic, leaving science completely stumped.
Okay, I want you to just imagine this for a second. Spontaneous, unprovoked bleeding. And I'm not talking about from a cut or a scrape. I mean bleeding from anywhere on your body, at any time, for no reason. For one young boy, this wasn't imagination. This was his alarming, everyday reality.
So let's get into the specifics of this case. To really wrap our heads around this mystery, we have to start with the patient right at the center of it all.
And the core problem here, it's just staggering. We're talking about a 12-year-old boy who, for over a year, was dealing with this bleeding that would just start. No cause, no injury. It would just erupt from totally random places on his body. Now, this didn't just pop up out of the blue one day. Oh no, this condition actually evolved over several years, and with each year, it got stranger and more severe. You can imagine what a deeply concerning puzzle this was for his family and his doctors.
So take a look at how this all escalated. It actually started when he was 8, with just occasional nosebleeds. Pretty common for a kid, right? But then, by age 10, it had morphed into something much weirder, spontaneous bleeding from his ear. And then, after a surgery, things took a really dramatic turn.
See, an ENT surgeon thought, okay, maybe this is a localized issue, and recommended a tonsillectomy. The hope, of course, was that this would finally solve the problem, but it did the exact opposite. Instead of helping, the surgery was like a catalyst. The bleeding didn't just continue, it got way more intense and started popping up all over his body.
And this just shows you how wild and unpredictable this thing became. The bleeding could erupt from his hands, under his nails, from his eyes, even his forehead. The locations were always changing. It was absolutely impossible to know where it was going to happen next. And get this, according to the case file, for an entire year, a full 365 days leading up to this point, there was not a single day he didn't have a bleeding episode. Not one. I mean, the relentlessness of that is just, it's hard to even imagine.
So you're probably wondering, what were these episodes actually like? Well, the case notes give us some really fascinating clues. While it was happening, he'd feel this intense weakness and pain right at the bleeding site. But then it would just stop, all on its own, in like 5 to 7 minutes. And here's the really strange part. It left no mark, no scar, nothing. And maybe the biggest clue of all? There was a clear emotional trigger. These episodes were often set off by anger.
Okay, so this brings us to the medical investigation, and this is where the mystery really deepens. Obviously, with symptoms this alarming, the doctors threw everything they had at it. They ran every test you can possibly imagine to find some kind of physical cause.
And the punchline? Every single test came back normal. Blood work, normal. Clotting factors, normal. Everything. Despite these incredibly dramatic physical symptoms, on paper, medically speaking, this boy was perfectly healthy. It just made no sense.
So what do you do? This is the question that had the medical team completely stumped. When the body is screaming that something is wrong, with clear, distressing symptoms, but all your tests say everything's fine, where do you even begin to look for an answer? You're forced to start looking beyond just the physical.
And that is exactly what happened next. When you hit a diagnostic dead end like that, you have to zoom out. You have to start looking at the whole person, not just their body, but their environment, their personality, the whole emotional picture.
And as they started talking to the family, a really specific picture started to form. At home, the boy was described as, well, pretty difficult, obstinate, headstrong. He apparently had a pretty violent temper. He'd throw things when he got angry. And his relationships with his siblings were not great.
But, and this is where the story takes a fascinating turn, that kid they described at home, he was not the same kid who showed up to school every day. In fact, it was a total 180-degree contrast.
At school, his teachers had nothing but good things to say, no complaints. They saw him as smart, a quick learner. And get this, if he got into a fight or a quarrel with another student, he wouldn't lash out. He wouldn't get violent. He'd just go home and complain about it later. It's like we're talking about two completely different people living in two completely different worlds.
All right, let's pull all of this together. So what do we have? We have these bizarre, frankly unbelievable physical symptoms. We have medical tests that all say nothing's wrong. And we have this stark black and white difference in his behavior between home and school.
What this case really shows us is this profound disconnect. On one hand, you have the physical evidence, the bleeding itself, which just defied any known medical explanation. And on the other hand, you have this undeniable connection to his emotional state, especially his anger.
And so this whole case just leaves us with this huge unanswered question, right? It really forces you to think about the limits of medical science. When all the tests can't explain what you can clearly see, what are we missing? It points to that powerful, mysterious connection between our minds and our bodies. And it really makes you wonder, what is the body trying to say when words just aren't enough?